Okay, you guys can get out your notes and we'll get finished up really quickly. And that way you guys can get going. Okay, let's finish up in this notes page first. And I think we should have all been right where it talked about. We just finished with the Code of Ethics. So part 7, where it says standards of behavior on the third, I guess second or third page, whatever you want to call that. So video, I can see my own hairdo there. Kind of crazy looking. Okay. So standards of behavior required by a healthcare provider to carry out their duties. 1 is confidentiality. Okay, information about patients that includes their history, their physical exam, dental or dental procedure, any kind of procedure that they have, must be treated with the strictest of confidence. So we have to be really careful as healthcare providers that we don't share information with who it should not be shared with. If any such information must be discussed with other personnel in the office or hospital, such discussion should take place in private, not in the elevator, not in the coffee shop, cafeteria, somewhere else where it might be overheard. And that's really, that's something that's really important that and you hear people all the time do that, but you just never know when people are, who they're related to and what's going on. You just never know. Okay, accuracy. It says to be accurate in following directions and in reporting. Report any error, accident to a supervisor at once. Ethically. Okay, these are all ethical issues. And all of these ethical issues are things that are really easy to do or to not do when you, they're just really easy to not do when you're not around other people, like when there's no accountability. So it's just, like maintaining confidentiality. Like the patient may never know that you broke confidentiality. That doesn't make it right. And this is where that integrity that I really stress comes into play. Same thing with accuracy. Like if you do something, if you mess up, then you need to make sure that you take care of it and you talk to your supervisor, and if you're supposed to write up a report, then you write up a report. Okay, honesty. It says never perform a procedure or give treatment that you're not qualified to perform. Okay, you have to be honest and know your scope of practice. 4, dependability. It says complete assigned tasks and ask questions to be sure you understand an assignment before starting it. Consult your supervisor when you're not sure. Okay, so again, just do what you say you're going to do, but if you need help, get help. Okay, you guys can actually go to this PowerPoint, Legal and Medical Ethics PowerPoint, and I'm just going to let you guys kind of follow along with me. I'm not going to put it on the screen because we're actually going to move through it pretty quickly because we've already talked about most of this. There's just a couple of things on here I want to hint at that I didn't quite get to in the other notes section. So go on over to, where am I? Licensure, registration, and certification. Hopefully you guys have already looked that up as part of your assignment, your vocabulary assignment. If not, make sure you know the difference in these. Okay, licensure is usually state run by the state. So like my nursing license is with Texas. Registration just means that you are on a list, like you're registered. Okay, the state has a registry of nurses, registered nurses. Okay, so this registry, and they list all the names of the registered nurses that are able to practice in Texas, or licensed in Texas to practice. And then certification usually is done by an exam, and a lot of times certifications can be national in scope. Not necessarily always, but they can be. But a certification is usually given by means of an exam. It's like you get a certificate, okay, it's the same word there, a certificate to show that you are certified, okay. Now, on page 3 here, we have standards of care and scope of practice. So standard of care, again, this should have been on your thing. Standard of care, level of performance expected of a healthcare worker, like I talked about. and carrying out his or her duties. Law of agency means that, hopefully you guys understood this in your vocabulary, but it means that if the person does something outside of their scope of practice, or if the person does something that's not within the standard of care and something happens, then the company or the organization that the employee works for is also responsible for that issue. So like if I'm working at a hospital, hey, I can get sued for something done, but the hospital can also get sued. That's law of agency. Okay, scope of practice, again, what you're able to do, what you're able to do as a part of your career, your job at that place. So informed consent, I talked about it a little bit, but it goes into a little bit more detail here, and then next year we'll really go into detail. Form that gives permission for the procedure or test that will be performed. So look, adults of sound mind can usually give this, but it must include the methods of treatment, so how the treatment is supposed to be carried out, why the treatment is necessary, so why this treatment, like why do we have to have this one? The risks involved, okay, so they may have a risk of a stroke or may have a risk of something else going on. Alternative treatment, so if there's any other options for them, what can they do? The risk of those alternative treatments, and then the risk if they decide not to do the treatment at all. So risks, all the way around. So those are all the things that have to be included when someone obtains informed consent. But also keep in mind that it has to be, they have to be informed. They have to be aware of what's going on. They have to be able to understand the consent as well. Okay, confidentiality. Let's look at this for a minute. Next few slides on here. Privileged information is confidential data and includes all medical and personal data that is disclosed within the healthcare facility. So sometimes you'll hear that term privileged communications, same idea. Okay, privileged information, privileged communications. That's the confidential data that is given that needs to remain confidential. That's the data itself. Confidentiality is the most long-standing, consistent component in all codes of ethics. I think you'll find it you probably found that in the codes that you looked at the other day. Okay, client information can only be discussed with other healthcare providers who are involved in the healthcare. Okay, not somebody on a different floor, not somebody in a different department, but people who are involved in that person's care. Confidentiality must be maintained in order to preserve human dignity. Definitely. Okay, people have a right to be able to share their own information. So, trust is built between the client and health professional by maintaining confidentiality. Okay, that's how you get people to trust you. They know that you're there for them. You're not there to make fun of them or to go on and share their information or whatever. It's definitely an ethical and legal responsibility. Patients' ethical and legal right to keep their medical information private. Results of breaking confidentiality can include civil suits, loss of job, or you can even lose your license to work. But confidentiality may be waived. Okay, that means it doesn't have to be followed when. These are important. Pay attention to these because you'll see these on the test. Third party request an exam. What that means is, like, let's say I go to work at Kimberly-Clark. And Kimberly-Clark says, okay, as soon as you start working here, we need you to go do a physical. Okay? Well, Kimberly-Clark is the one that's paying for the physical, and they're the one who wants the physical. So if they're the ones who send the information over about me getting the physical to the doctor, they have a right to get that information back. Okay? So that's what that's talking about. Oh, that's an example. Client sues a physician for malpractice. Okay, so once you sue someone for malpractice, all of your info is going to be up on this courtroom wall. So if somebody gets sued for malpractice or something else that's going on, healthcare world, all of the charts are going to be, in plain sight. Like everybody's going to read what's going on. Client signs a waiver allowing the release of information. That's it. Like for me, I always sign, like my kids at their doctor's offices. I have, obviously my husband and I are both on there, but I also have like my mom and my husband's mom, they're listed on a waiver so that if they ever have to take them to the doctor or something, they can get their information and it won't be a big deal. Confidentiality, it says, I'm on the very last couple of things here. It says, in all states, certain patient information is exempt by law and reports to property authorities are required without consent. So these are things that have to be reported regardless of confidentiality and consent. Births and deaths are filed with the state. So births and deaths. Emergencies, okay, that, does include confidentiality because the ambulance, the paramedic needs to be able to communicate with the emergency room doctor without worrying about confidentiality. Injuries caused by violence, okay, and that doesn't mean that you tell the whole world about it. It means you can tell the police about it. Threats of serious bodily harm to another that may reasonably be believed. So let's say you have a patient who comes in and gives you the details of how they're going to, injure their grandma. And they sound pretty reasonable, and you think they may be telling the truth, that that's really their plan. That might be an example of a reason that you could break confidentiality. Child abuse, any type of child abuse. Vehicular accidents involving drugs or alcohol. Okay, once drugs or alcohol is involved, then it also becomes a police matter. So again, it's not that you tell the whole world what's going on. It's not, confidentiality is waived, for everybody, but it's waived as far as getting it to the authorities and who needs to take care of it. A reportable, communicable, or sexually transmitted disease. There are certain diseases that we have to report to the state. We have to report their occurrence to the state. One example would be like tuberculosis would be one. And then STDs, there's different ones that have to be reported. Client is incompetent or incapacitated, okay? So if they're incompetent or incapacitated, then, if they have a family member or whoever's taking care of them, you have the okay to give their information to them. I'm sorry, my nose is running. Asking to commit or hospitalize a psychiatric client. So if they have to go and ask or, put their case in so someone will order them to be committed, that's another reason. Okay, HIPAA. Look on here, Health Insurance Portability and Accountability Act. This is a federal law, national law that provides rules for the use of health information. It has to be kept private, and there's a whole bunch of other rules that are involved in it too, but those are definitely some things. So breaking this law, you can have fines. Medicare can take away the privilege of that hospital, remember, to treat patients. So those are some things that can happen as a result of that. Again, with the license, you can lose your license. I mean, this is a big deal. We're talking thousands upon thousands upon thousands of dollars in fines. And one more thing on there. There's a few safeguards that we'll talk about more next year. Some of those are just like the computer systems. Whenever you go to the hospital, everybody kind of does computer charting at this point. There's several safeguards that people use, like passwords, timeouts, and those kind of things. And that has really helped to get rid of some of this. Anyway, get rid of some of the issues with, like, people's charts being out and papers laid open and things like that. Okay, real quick, medical record, very last slide. Because all information that's recorded must be factual. Okay, I don't write my opinions down in somebody's chart when I'm saying what's going on with them. I don't ever write my opinion like this person is crazy, okay, or this person is, patient can't get up and move because they're fat. Okay, that's an opinion. Okay, what you might put is, patient weighs 700 pounds, and I'm totally exaggerating that, and is unable to get out of bed, or unable to hold their own weight on their legs, okay? So you have to be very careful when you put things into the medical record. You don't just put whatever, comes into your head, or, you have to put things that are factual, that are objective, Okay, I don't say, oh, the patient looks like they're in pain. No, I say, patient is crying and complains, states, my stomach hurts so bad, put it in quotes. Those are things that you write down. You don't put down just what you think or what you're feeling. Excuse me.
Dashiana Ford, come to the office, please.
Questionable information should be labeled as opinion or assumption. So if you did have to put something opinionated in there, it should be, in my opinion, blah, blah, blah. Okay? Any information that's not relevant to the care of the client should not be recorded. Okay, so any information that's not relevant, if it doesn't matter, then you don't put it, if it has something to do with their personal lifestyle or whatever. Now, sometimes personal things do matter, and if you think it does, then add it in there, but other than that. And that goes to say, as far as confidentiality goes, not just medical information about people has to be kept confidential, but any information that they give you, even if it's just personal information, whatever that is, like that has to be kept confidential. Like, so that is legal and medical ethics. We're going to talk about advanced directives later this week.